Welcome everyone to this special event on improving your cardiovascular health and longevity. Our special guest today is Dr. Guy-Paul Gagné, a renowned expert on the science of Transcendental Meditation, or short TM. Today, Dr. Gagné will explore some of the groundbreaking science that sets TM apart as a meditation technique shown to significantly impact cardiovascular health. He is going to share some compelling research with us, showcasing TM's power to reduce rates of heart attacks, stroke, death, and cancer. And he'll also explore the possibility of TM in bolstering the DNA of our immune cells, leading to enhanced immunity and improved health. And the session today, just so you all know, we'll start the session with a presentation by Dr. Gagné and then stop the recording so that you can ask your personal questions. And I know a lot of you have already asked for the recording, so we will arrange that the recording of the talk will be available to you who joined afterwards. So we'll share that and more details on your questions too. So we'll have time for your questions that won't be recorded, so you can keep them and already put them in the chat if anything comes up during the talk. We'd love to hear your comments, and you can even come on and ask Dr. Gagné yourself if you have any specific questions. So before we dive in today, and now with Dr. Gagné, please allow me to take a minute to introduce you to everyone. And for those who haven't met Dr. Gagné before, he did a talk with us earlier this year. He is a medical doctor and former assistant professor in the Faculty of Medicine at McGill University in Montreal. And he has been a prolific speaker on maternity care and the scientific research on TM, including its application in education and stress management. And on top of all of that, he has 30 years of experience in clinical practice, teaching, and research. So a warm welcome to you, Dr. Gagné, and we're thrilled to have you with us today.
Yeah, thank you very much for inviting me. It's a real pleasure. I think if we're going to start, I will share we do this sharing of the slides. Let me see if I can do this. No, I don't think you can see do you see the full screen slide?
Yes. Perfect.
Oh, great. Because sometimes with Zoom, we never know. So yeah, hi to everyone. I'm very pleased to be with you now. Maybe I'll tell you my personal history about TM. I've learned TM about 40 years ago. I was in my residency at McGill University, learning to be a gynecologist, and I was up all night delivering babies and quite exhausted and needed some sleep and some rest and some stress management, I guess. So I got back in the 70s, late 70s, beginning of 80s. There was not much of a choice, about when you look at meditation. TM was there, and we didn't have this big development of all sorts of mental techniques after that. But I happened to go to see a scientific research about TM. And it was published in a medical journal, and I was impressed by, what I could see. I could see it's very nice and maybe promising, especially they were saying that 20 minutes of TM is worth about 3-4 hours of sleep, even more. Oh, I needed that. So I said, let's try this. And I got very quickly, very nice results. And I was very happy about my practice, and it's gave me the energy and the clarity of mind and everything I was looking for to be more effective and more productive in my professional and personal life. So I just kept going. But then being a physician, you know, I also, you know, I had my my own skeptical mind, you know, at the beginning, and I just kept going, looking at scientific research. Scientific research kept developing a lot about TM and other meditation as well. And I was kind of surprised to find that my experiences, everything I was, you know, I was experiencing with my life and with TM got confirmed by scientific research as I was going. So it gave me this impetus to keep going, and that's why, you know, I'm getting more involved in explaining what is TM, what is scientifically, what it shows, what you can do with it. And so over the years, I become some kind of I got some expertise into this. So this is with this background that I'm happy to speak with you now. You know, transcendental meditation, we say unique benefit on cardiovascular health and longevity. TM has a long story about cardiovascular health, because very early in the research about TM, some discoveries were done, demonstrated that the stress the stress was reduced, cortisol level were better, and skin resistance was less, and all that. Very, very early, TM became very popular for stress management. And we all know that stress is a risk factor for cardiovascular health. So eventually, you know, the research went into this direction a little bit, and finally, it's in 2013 that kind of all the research on cardiovascular health converged into this policy statement of the American Heart Association. It said, you know, the American Heart Association put together a committee of experts in cardiology. They were independent experts, not necessarily practicing TM or being involved with TM, but they reviewed the whole scientific literature about all sorts of non-pharmacologic way to deal with cardiovascular health. So they came up with this conclusion. TM is the only meditation practice that has been shown to lower blood pressure. That was in that time, that's their conclusion they came to. Also, they had other conclusions that they came with this report. They said transcendental meditation practice is associated with substantially reduced rate of death, heart attack, and stroke, and actually improve longevity. Because if you're reduce rate of death, it's because you improve longevity. So anyway, so that was a big kind of approval for this scientific committee of the American Heart Association. And they kept saying that alternative treatment that include TM technique are recommended in the treatment plan of all individuals with blood pressure greater than 120/80. For those who are not familiar with scientific recommendations for these, scientific organizations like this, they have level of evidence. The level of evidence for this recommendation was 2B. What it meant is that, the level 1 recommendation are very fully approved, and it's for health professionals. When you have a level 1 recommendation, it means you must use this. Let's say if it's a pill or something, or a treatment or something available that is fully, completely proven, and it has to be used. You must use it. When you're in the second level 2 recommendation is you may use it. It's good, it's recommended, but we still need, more research to put it into 1. So that's why it's a level 2. because, TM never went through huge research involving thousands and thousands of patients or people involved. There are many little studies, so you have to put them all together to make it big enough to come to a conclusion. Anyway, conclusion was very good, and the author of the president of this committee, the lead committee chair, Dr. Brook, he said this into an interview. He said, TM stood alone amongst all the meditation technique because of the great deal of research and corroborative evidence. You have to look at you have the evidence of directly involving cardiovascular, but there is a lot of corroborative evidence in stress management and all sorts of this. So in order to make this conclusion, they had to look at the whole thing. You see, there were far more studies in relation to blood pressure and hypertension on TM as compared to other meditation. And then he went on and saying it's about heart attack and everything. It reduced the risk and so on and so forth. So my presentation today will be, first, we're going to go backward and look at maybe some of the most interesting research that were done before 2013 that gave rise to this conclusion. But also at the end, near the end, I'd like to show you because some other study came after that. And it's very recently, we understand more the way it works, the mechanic by which a mental technique only can give that much of a physical difference in outcome and so on and so forth. So basically, that's very interesting. It was very interesting for me as a physician and as a scientist. So I'd like to share it with you, the difference. Before we go before we go into the research, I'd like to say that first I am not a TM teacher, so I'm not an expert in teaching Transcendental Meditation. So therefore, today we won't be learning how to do it. But I like to say but at the end, during the question period, we have some teachers of TM. So if you have any specific question, you can ask, and then they'll give you the details of everything you want to know. But I like to say that first, having studied many other type of meditation, the first thing I want to stress is that all meditation are not the same. They're not they are good. Meditations will all release stress some amount of stress in a certain way, but they are not the same. They're not as effective all the way, and TM is a bit of a special one, because actually, you see, the TM teacher will explain it to you, but when you want to learn, but briefly, it's like if you compare the mind like to an ocean or a lake or body of water, at the top of the lake, you have all these waves. And this is the active level of mind. Thoughts would be like waves, it never stops, we always have these thoughts, and we go from one thought to the other, it is the active mind. It goes horizontally. Most of other techniques, they stay there on the horizontal part of the mind, and TM has this capacity. That's why they call it transcendental, because it explored, it's plunged into quieter level of thought, into a very silent source of thought. It's like it's very wavy on the surface, but if you go to the bottom, it's very silent, very calm. This is why, and that was my first, actually for me, the day I started TM, I had this very clear experience. Never had that before. It's like, you cut the cable of the elevator and boom, you go there and it's total silence. I've never been there. And so after that, that's why it's one of the reasons why I kept going so so faithfully, because it was a true difference, true experience. So anyway, so that with TM, you're learning to dive in the mind, into the quieter level of thought until it's very quiet. So it's different. It's not the same like other techniques are more concentration or contemplation or anyway, but they still are waving on the top. Anyway, so that was my little introduction to TM, but you can have more specific question at the end if you want. But on the scientific point of view, what it does and what is unique, this is a scan of the brain of someone practicing TM, and you can see here there is, while you're practicing, the top part of the brain is the thinking brain, and on these scan, you know, when it's red, it's because there is an increase in blood flow, and when it's blue, there is a decrease in blood flow. Blood flow is decrease. Blood flow is increased at the top of the brain, in the thinking brain. The lower part of the brain, to make a long story short, the lower part of the brain, it's the automatic pilot of the brain. It deals with the automatic things that you never have to worry about or think about it, like your respiratory rate, blood pressure, sugar level, digestion, all sorts of automatic, like heartbeat, the speed of the heart. Everything is taken care of by this automatic pilot. It's like the vitals part of the brain that takes care of keeping us alive. And with the top part, we think, we make decisions and everything. So it's very unique. What is very unique to the practice of TM is this blue part here. During the practice of TM, the brain, the thinking brain, stays very alert. But the bottom part of the brain, which is the automatic pilot, it goes to rest much more deeply than you would do during sleep. So it creates this state of consciousness. It's a new state of consciousness, actually a fourth state of consciousness that was discovered in the 80s. I was impressed with, because they didn't have scan like this, but with other methods, they were theorizing that this is happening. Now we see what is going. It's called restful alertness, you know, rest at the bottom of the brain, alertness at the top. So this is unique to TM, and that probably the blue part here, it does explain most of the advantage for cardiovascular health, because cardiovascular is on the automatic process. It's like heartbeat and you know, the cholesterol level, glucose level, and all of these automatic things. They should not go out of way. You know, they should stay in equilibrium. And if this bottom part of the brain works properly, you're in good shape cardiovascularly also. So anyway, so that's why I bring this up, because that's one of the explanation for the success. But we know even more at the end of the presentation. I'll get there. Anyway, so this is an example. I like to show this example because it's a very in practice. What does it do, the TM, when you experience restful alertness? Alertness on the top, rest at the bottom of the brain, okay? So this study was done on teenage. In the US, there is some kind of an epidemic of high blood pressure on very young people. So they were teenage at school, and they taught them TM for about 4 months. You know, they taught them TM, and they were practicing a 15-minute of twice a day in school, and during their school period, they taught TM. So what happened, of course, you know, because they had some more rest at the bottom of the brain, you know, these basal ganglia and all of this, blood pressure went down. Blood pressure went down, so that's the restful. And then they were surprised because even when the study stopped, after 4 months, the study stopped. So these youngsters what did they do? I'm not sure they could do it at school, so they had to do it at home. Some of them did, some of them more or less. Anyway, everybody was surprised because 4 months after they went back, took the blood pressure, it was still low, surprisingly. So it kinds of, what it shows is that the kind of rest that it gives tend to last. It's not something that goes immediately. Like when you take a pill for blood pressure, if you stop the pill 2-3 days after, it's going to be back up probably, but not with TM. It's a lasting thing, and we'll see at the end. We know now more why it does this. But anyway, that's an observation. But at the same time, the same group of people, they did another study on them, because while they were practicing, they took some other information. Another study on the same population showed a beneficial impact of TM on absenteeism, rule infraction, and suspension rate. So these students, they became better students. They were making better decisions. They were more faithful about going to their class, and they were not breaking the rules. So this is the idea about the upper part. The thinking brain was better. They took better decisions. They were more like, they make less mistake, sort of. So this is an example of restful alertness. Restful is on the left, alertness is on the right. You have the benefit of health, of practicing TM, but also somehow in a very natural way, you don't make mistake anymore, and you just do whatever it's needed for progress in life. Anyway, so that's very interesting, because it's a living example of restful alertness. So now we go into the research, but before I go into the research, how experience affect our health. And I have to explain two different theories here. Brain plasticity. The brain has the capacity to modify its structure depending on experience. If you have a bad experience repetitively, the brain will wire itself differently in order to face the situation. And it's the same for happiness. If you're very happy, the brain will wire itself for happiness more, and then, you'll be in better health. So brain plasticity is very important. That's going to play a role in cardiovascular health. And you have another very important theory is allostatic theory. When exposed to stress, the brain, as I said, if you're exposed to stress, the brain will wire itself for survival instead of development. You see, these little kids before, they were wired for probably survival more because of their social environment and things like that. Their blood pressure were a bit higher. So they were thinking very short term. They would miss class, don't believe in school, and do all of these things that someone short-sighted vision will have. So anyway, so exposed to stress, the brain will go into what favors survival. And survival, we call it allostasis. Allostasis, it means the compromise that the brain has to do, or the body, the physiology has to do in order to survive, instead of being very nice and quiet and development mode. It does this at the cost of development, homeostasis, equilibrium. The cumulative effect of these stress, if you have them one after the other and you don't have time to recover, then it's called the allostatic load. And cardiovascular disease, now it's pretty much understood that they're due to the accumulation of stress over the time with the years, it's with age. Some other factor can be involved, of course, but usually it's an accumulation of stress called the allostatic load. Allostatic load, it's just an illustration of this. It's all about cortisol. Cortisol is the stress hormone. Normally, cortisol is the baseline is supposed to be low. And then when you have a stress, you raise your cortisol level in order to face the situation. And then after the stress is gone, the cortisol level should go down to what it was before, like to baseline. But with allostatic load and then this brain that is wired for survival, what happened is that you go up, but then you cannot quite go down to baseline. And then next time you have another kind of a stress, and then not quite to baseline, and then not quite to baseline. And you end up with a new cortisone baseline, which is survival mode. It's a higher, then chronic stress will give rise to higher baseline of cortisol. But then when you have to face a challenge, you're not able to produce more cortisol because you're already high. So the response, you have a lower response to acute stress. So meaning eventually life becomes discouraging because you face, it's difficult more, like it's a struggle because it's difficult to face the situation because you cannot go higher than when your baseline is. So physiologists have established that the difference between this level of cortisol and this level of cortisol is allostatic load. And they were looking at ways to measure allostatic load on a person. Let's say, for example, you take some blood from me and you say, you can tell what's my allostatic load. Physiologic indicator of allostatic load, they are all listed here. Systolic, diastolic blood pressure, cholesterol. We all know cholesterol is related to cardiac health, and blood pressure, of course. And then glycosylated hemoglobin is a marker for diabetes. Cortisol, norepinephrine, stress hormone. And then the last one at the bottom, DHEAS. It's a long name, but it's a marker of aging. Okay, DHEAS, dehydroepiandrosterone sulfate, is high when you're born and when you're young, and then as you age, it goes down. All of these things that are on this list were shown to improve with TM. Many researches were done, small research, but one after the other, they all show the same, that they are, especially, it's a very small study, but the one about the DHEA show that meditators usually have a DHEA 10 years younger than their age. Younger, because we're going to be talking about longevity. So anyway, so TM usually improve this. It is what they call the metabolic, we'll see in another study there, syndrome, the metabolic syndrome. It's all of this together makes metabolic syndrome when it's not functioning properly, and studies were done about this. So anyway, so right at the beginning, you see that TM has something to do with this thing, and that's the illustration of what TM would do for chronic stress. It brings the cortisol baseline back to its baseline, and then the homeostatic baseline is created, lower baseline, and also you can have higher response. See, there are two studies. You have the reference at the bottom of the slide, but two studies were done. These were on a university student. They took a group of students not practicing TM, and the other group, they taught them TM. And after a while, they compare both. The not practicing TM, they had this higher level of cortisol and not responding very well when they were acutely in the lab. They submitted them to pain and stuff like this in the lab. So they were not able. And the TM practitioners, they were like this, much lower. And then when they were surprised. More cortisol was produced when they were submitted to pain in the lab. So at the beginning, they said, how come they're practicing TM? They have more cortisol. Yes, because now they have to fight. The fight or flight was more effective, but the good thing is that it comes down to the baseline at after that. So it's called resilience, the capacity of the cortisol to go down to baseline. Anyway, then we go into this research. We start very early, 1989. First time they taught TM to a group of elderly person in an elderly home in the US. They taught TM and followed them for 36 months. The idea of the study was to reduce blood pressure at the beginning, reduce stress, blood pressure. It did work. They had two groups. They had three groups. One was the TM group. The other group was a group, they taught them how to, for 20 minutes twice a day, exactly the same amount of time as TM, but to do mental exercise, like find a word and then a synonym of this word. And then they had some kind of a game to play with their mind. They were elderly, like mean age was about 79 at the beginning and 81 at the end of the 78 and 81 at the end of the study. Anyway, so the big surprise is that 3 years after, 100% of the elderly person practicing TM were still alive, and 73% in the control group, and 63%, the third group was business as usual. They didn't have anything to do, no intervention. So no intervention, small mental intervention, and then TM. So you see the difference. That was the first time people started to say, oh, it has an effect on longevity. It's a bit strange. What's happening? Why is it that all of a sudden you have some kind of a 20% extra longevity compared to the other person not practicing? So that was first time. Explanation were not understood exactly why, but that was a good news. Then they kept going with some research. It's 1996. I'm just going back, just to reach the 2013 that we saw at the beginning. TM was tested with in the treatment of patients with coronary heart disease. These patients were already having angina and heart problem, and they taught them TM and kept. After a year of practice, they had improved their exercise duration, their maximum workload that they could do on a treadmill. They were testing them on a treadmill, and then they had less angina, a lot. And so that was very surprising. People kept saying, well, how a mental technique can actually affect the arteries of the heart like so much and improve them at this point. So these are the kind of studies that the American Heart Association, considered. Although they're small, but then you pile them up, it's not so bad. Now, the most impressive one, because it's a physical measure of decrease in carotid atherosclerosis, you see, over time, the arteries the wall of the arteries, they become thicker. And that's called atherosclerosis, thicker and thicker. And when you age, or if you have a lot of cholesterol collecting around and in the wall of the artery has many layers. So some cholesterol can goes into the layers or inside the lumen, and then eventually blocks the artery, and then you have an attack. Okay, so they trained these group of, it's in 2000. They trained this group of for 6 to 9 months, and what they saw is actually during the 6 to 9 months, the thickness of the artery of the health education group, the group not practicing TM, had actually increased in size. It became thicker, but the group practicing TM, it had become thinner and more normal. So actually TM was shown to reduce the thickness of the artery, the atherosclerosis artery, making it very much better. And now people were wondering, oh my, how a mental technique can actually act so in depth in the health of the arteries of the body. Carotid arteries are very important anyway. So that was a big surprise. And at the end, I'll tell you why. We now understand what happened to this. But at this time, nobody could explain. It's just an observation that it's very good. Of course, everybody was very happy. And of course, these people, they were in much better health. But what was the mechanic of it? From the mental, technique, it goes into the body, and where does it happen to just heal the arteries? Okay. So metabolic syndrome, I told you about just earlier. That's another randomized controlled trial. A group practicing TM and the other group were not practicing TM. They were 103 subjects, and they practiced for 4 months. It's important to see. It's not a long time. They've practiced for 4 months. They had improved systolic blood pressure, which was expected because we knew from before, but that was new. What was new there is improved insulin resistance. That's another profound change. It's for diabetes, type 2 diabetes. And that was also a very profound change that was not expected to be that profound, and improve heart rate variability. And actually the conclusion, it helped in the treatment of metabolic syndrome and diabetes because of all the rest of the results I showed you before, like cholesterol and everything else. But here was this insulin resistance, new thing that made the researcher was interviewed. Why did you choose TM because there are many other things you can evaluate, and you wanted to help people with metabolic syndrome. Why did you choose TM? And here you have his answer. TM is one of the techniques that has been studied the most and the most rigorously in randomized controlled trial. It's a bit of what I showed you before. And it is highly standardized and protocolized, meaning that the TM that was practiced in the 60s and the 50s and TM that is practiced today is exactly the same. It hasn't changed. It's exactly protocolized. And for instance, TM is trademarked, and you have to be a certified instructor to teach it. So researchers like it because actually you can reproduce your results, because if this technique change in 2 years, then your study is outdated because it's not the same technique anymore. So we selected TM because there were prior studies that suggest very consistent physiological response on blood pressure. So they wanted to go deeper. So they discovered that it's actually better for many other things. For the metabolic syndrome. Metabolic syndrome is a cluster of symptoms. You have usually a bit of overweight, high cholesterol, high blood pressure, a bit of type 2 diabetes, and it's a cluster of symptoms and risk factor that will eventually turn out to be cardiovascular disease. So now that's the clue. That's the very big the study that from 2005 to 2012 went on just before the American Heart Association report was done. It started in 2005 with a group of 202 subjects, mean age 72 years old at the end, but at the beginning they were like 62 years old, and they had some mild high blood pressure, and they taught them TM again for about 4 or 5 months. Blood pressure went down. Everybody was very happy. But what the researchers decided to do is to see on the long run, what does it do? So they kept following this group of people, and the control group, both groups, the control group was health education, and the TM group, they kept following them for 10 years after. So what they saw, and that was very convincing it was probably one of the most convincing results for the American Heart Association, is that Cardiovascular mortality, myocardial infarction, and stroke were reduced by 48% in the TM group. All-cause mortality was reduced by 40%, including cancer, which was not an outcome, a main outcome of the study. But after 10 years, they had some record about what happened to these people. And life expectancy at large overall was improved by 23%. Okay, so that was over and above what medication and antihypertensive drug and statin and all of, because these people, they were followed by physician and they were taking the medication. Just in comparison, antihypertensive drug and the statin is for cholesterol and other drug, it reduced the risk of these myocardial infarction, stroke, and mortality by 25 to 30%. So they had another 48% extra on top. So that was very good. And you see here on the graph, the green line is the TM group and the dotted line is the control group, and you see there is quite a difference. You know, it's even mortality and stroke and everything rates there, and there's much less. You know, 85% even free after 6 years, a year 73%. That's the measure of this, and it took about 9 years. And after 9 years of follow-up, still they were not exactly together. There was still this little difference between the group. So that was very encouraging, and it gave rise to this. I'm taking you back to the policy statement of American Heart Association and conclusion. So that's basically on these and many other research, but I've just made a summary of these research. So now there are some other research, just to show you one, even in Canada, provincial medical plan. There were 1,400 control were matched with members who practiced TM. In this province, they were able to match the people practicing TM and not practicing TM on physician payment. You know, that's the cost of health costs, actually. So they could measure the 13% decline in medical year and medical expense each year, which is a cumulative decline of 55% in 6 years. That was done a couple of times, even for elderly or young and any age. You had always a bit the same. So that's just to tell you that it's a wide range of benefit that now you can ask, you know, what's going on? And you know, how to explain this profound effect on health and longevity. Okay, so I'm nearly done, but I want to take you to some the latest research that was actually published in 2021, and it's about TM's epigenetic effect at the DNA level. As you know, or you may know, that it's a very new science that we can now map the human genome and DNA and everything. As researchers can now map and find out a lot of what's happening at the level of the molecular DNA in the cell nucleus. Okay, so anyway, what is epigenetic? See, we thought before that chromosomes were frozen. You're born with your chromosome from your parents and you're done, that's all. But it's not anymore true. Many years ago, they've started to discover that actually the DNA can actually manifest itself more or sometimes less depending on your experience. It's like if there is a dimmer switch on the DNA. If you go up with the dimmer switch, some part of DNA can manifest, good or bad. They can manifest more, and if you decrease the dimmer switch, they can be quiet down. You know, like if you have a disease in your family, and you happen to have epigenetic factors that will prevent this from happening, you may never get sick. And if you raise the dimmer switch, you might get it. So it does happen in the same way. So that's epigenetic. So they did epigenetic study on TM practitioners. Just here, it's just a graph to show you how it happened. You know, the environment will, if I inherit my genes from my parents, but my environment may be good or bad. If it's bad, repeated stress, then epigenetically I will start to collect allostatic load, and my brain will go into survival mode, and it's going to influence my physical and mental health, and even the behavior. It can go to violence, because a brain in survival mode, it can react two different ways. One way could be aggression or fear. It's both. It's one, depending on their personality and everything. Some people become more like easy to crank up, and some other will just go hiding and be very shy and everything like this. So anyway, so that's the fight or flight stuff. So basically what TM does, I did explain, I'll just come back to that. It creates this very unique stressful alertness factor. It's a concentrated form of silence, experience of silence for 20 minutes that will silence probably all the noise, that we have all in our life and all the worries and everything. And then epigenetically, it's going to be very benefit. That's the theory. That's what we thought, That's going to be very benefit, and it does influence physical, mental health, and behavior. But now we have a demonstration of it. This is Transcendental Meditation practice, evidence for prevention or reversal of stress effect harmful to health. Okay, that's a very recent research, 2021. And what they did is that they actually map the DNA of 23 long-term TM practitioner TM. Long-term means the age they were about 65 years of age with 25 to 35 years of practice of TM. So they took long-term TM in order to make sure they get something, because very expensive kind of research. And they compare to 22 controls. And what they found is a total huge difference between practitioners and not practitioners. Actually, 200 genes had significant changes. And you see all the genes are here, you see all these lines of the 200 genes like this horizontally. And the columns here, this is the meditating TM and the non-meditating control. And you see the difference. There is lots of red here. 136 among these 200 genes, 136 were down-regulated for the TMer. So they were up-regulated for the control and down-regulated for the TM. And then 64 were up-regulated for the TM group and down-regulated. It's exactly the opposite. I made the squared out just to show you the difference, because it's exactly the opposite. And when we say down-regulated, it means the dimmer switch was up or down. So which one? So 200 genes. I'll show you quickly. The up-regulated genes, the genes that were enhanced, increase, were 13 defense response genes, which is good, okay? The genes that were down-regulated, the dimmer switch low, okay? 35 stress response genes, 65 cardiovascular disease genes. Here is the answer. Why is the effect on cardiovascular? It's wide and profound, okay? Another one is 6 genes inhibiting energy efficiency. It would take me too long to explain to you, but that was actually very important. And this is, researchers are figuring out what it means, but actually into every cell, there is a little battery, which is the mitochondria. Mitochondria is the little battery that produces energy in a cell. And so they have these genes, some genes over time, they inhibit the energy of the cell. So these genes that inhibit energy of the cell were down-regulated, means more energy to the cell. You have to understand what it means. And one gene actually inhibit longevity, and this gene is telomerase. Anyway, that's, if you want more detail, I can explain after, but anyway, that's good for longevity to have this. So they found this out and said, oh my, this is a genome-wide change that TM would produce. And then these researchers don't mind the graph. It's too complicated. Even myself, I can't figure it out really, but they have this kind of computer program that it's called Ingenuity Pathway Analysis. They analyze the relationship between the genes, because genes, they don't act alone. They act with other genes to produce a disease or to produce a protection or produce that and that and that. So they did this Ingenuity Pathway Analysis, and that's what they found. That's interesting. See, they say TM upregulate the red one. 4 antiviral bacterial gene, 3 antimicrobial cancer gene, 5 anti-cancer genes, which, and you see the cancer survival just before, that's you see maybe the explanation here, but check that one. The last one is very important. 7 anti-inflammation genes, and I'll get to it, but that's becoming very important. 7 anti-inflammatory inflammation genes. And then if you look at the genes that were down-regulated, 64 were cardiovascular disease, again, because that's, and coronary artery disease. This is all this coronary health. 62 were with hematologic disease, 34 were diabetes complication. You see, this is the diabetes that we saw earlier. It's explained now by this epigenetic effect of TM on the DNA. But then the third one, the one at the bottom, 49 with inflammation again. They down-regulate the genes that produce inflammation, okay? So that should be very positive. So because of that effect of inflammation, the researchers said there must be something hiding in there about inflammation that we don't yet understand. And then they produced that this year, 2023, just in January or February, was published this paper, which is a secondary analysis of the first. It concludes that Transcendental Meditation practice show reduced expression of the, I don't want to make it too complicated, but that's so nice, conserved transcriptional response to adversity, CTRA, okay? And now I explain. CTRA, it's a group of genes that usually is triggered for when you have a stress. CTRA is upregulated, okay? CTRA is now considered to be the molecular signature of chronic stress, okay? It is like the physiological memory of actual or previous threat or challenge that keep going. The thing is, when you upregulate the CTRA, it does not forget. Your physiology now next time will just go higher and higher and higher. So this is some kind of vicious circle that it's starting. It's the memory. This is why people, when you're under a lot of stress, okay, I'll give you an example. It's very well known that if you lose a loved one, like someone, your partner or a family member die suddenly, or anyway, you're in a shock, you know, like some of these things that happen over the world with wars and everything. When something like this happen, it's very well known that in the first year after, when you're in grief, you know, in the first year or even 18 months, the mortality rate of people is increased from all sorts of problems like cancer, heart, infection, influenza, and everything like that. Why? It's because you activate CTRA, okay, from the stress. And CTRA has two characteristics. It activates inflammation at the cellular level, and it deactivates protection against infection. So you're more subject to infection or inflammation at the level of the cell. And now here is the big thing. Cardiovascular disease is now thought to be due to inflammation more than it is from cholesterol or high blood pressure and all of these things. Now people, researchers are, and that's the very new thing, is that cardiovascular disease, cholesterol and high blood pressure are just a symptom of it, but the cause at the very bottom of it is inflammation at the level of the cell. And you see the thickness of an artery usually will never necessarily block the artery unless there could be some cholesterol there, some plaque, but then if there is some inflammation that get into it, then it starts to swell from inflammation and then it blocks. This is why people sometimes they have heart attack after they had a big emotion. We know this. Huh? So that would be due to CTRA that increase this inflammation at the level of the cell. And then if there is already some narrowing of the artery, it blocks it. So this CTRA and inflammation is the new theory for heart disease and everything, and people will start looking at this. Anyway, so now we find that TM compared to group show lower expression of CTRA indicator gene, which is probably the reason why everything was good in the previous studies I showed you. Anyway, that's pretty much it. TM improve immunity and help physiology to forget past trauma. And if you speak to your TM instructor sometime during instruction and after that, and sometime when you have some specific experience during your practice of TM, they'll say you're eliminating deep-rooted stress. That's been taught this way for decades now, that TMs is able to eliminate deep-rooted stress, but we never had a real a physiological medical explanation for that. It's probably due to CTRA, the way it goes. So it takes a cell like this that is stuck with inflammation around. It can make it the new cell very clean and nice and working nicely with lots of energy and everything. So that's basically this. The only limitation of the study I just showed you, the whole thing I just spoke about CTRA, that was shown on long-term TM practitioners. Now you see, we don't have 35 years of practicing TM. Me, I have it, but maybe not many people. But the reason is that they didn't have a shorter term TM practitioners to compare with at the beginning. Maybe they wish now they had one, but they will have probably in the future. But I remind you that the good result I showed you about cardiovascular, high blood pressure, everything else is after only a few months of practice TM. So it's in the past, many studies were done like this. Like there was a study about pain, the management of pain, the brain, how it react to pain. They took 30 years practitioners of TM. They said, oh, you have 50% decrease of reaction to pain in the brain. But then they took the control group and taught them TM. After 3 months, they had the same 50%. So it's probably, we can theorize very confidently that CTRA is involved at the very beginning, the first time you transcend. It's probably a bit of an effect there because that's the way the rest of the studies showed. Okay, so just to give you an example of that, that was mental well-being of healthcare workers during the pandemic. And you see depression, anxiety, somatization, and insomnia was reduced by 45% only after 2 weeks of practice. That's incredibly quick. And you see insomnia, the symptoms, during the pandemic, you have all these burnout of physicians and nurses, and it's still going on, unfortunately. But you see, the researcher said this rapid and dramatic improvement in stress-related symptoms is not often seen with the use of medication, much less with other mental technique. You see, what happened is that the trauma that these people had, somehow CTRA was downregulated and their physiology forgot the trauma. It's a memory that is gone. It's like, if you live through trauma, sometimes it's very difficult to forget. But with TM, it seems like it can physiologically forget. Okay, this is the same thing for PTSD. That's all. PTSD is also a form of chronic stress and trauma that stays for, like the veteran that went to war and they had these very strong, bad stress, and they keep reviving it, and then they practice TM, and in a short time, 4, 5, 6 months, it's wash off or 61% of it. Not completely, that's what TM does compared to other techniques here. Anyway, that's all. Thank you very much for listening. I hope you understood at least a little bit. I hope I didn't make it too complicated. I would be happy to answer questions, and also we'll have Anne-Marie with us, a teacher of TM, so she can also help us on specific question about this. I'll just stop sharing now.
Great. Thank you so much, Dr. Gagné, and for this amazing presentation. I think I'm myself, even teaching TM, there's so much in terms of the research that you present so well that, yeah, it's a real joy. And a treat for us to learn and hear. And yeah, I know some are just saying that they weren't able to join from the beginning. So we'll share the recording with everyone after the session too. And we'll actually stop the recording now so that we can open it up to all of you to ask your personal questions if you have specific questions for Dr. Guy-Paul Gagné, and we can follow up. So we'll do that right now. And if you have questions, you can either raise your hand and come on mute. We'd love